name is Julie. I'm going to be a student nurse today. Can you tell me your full name and date of birth? Okay, Mr. Martin Johnson, 1/2/23. Perfect. Do you have any allergies that I need to be aware of, specifically latex or anything? No? Perfect. Alright, so today your doctor has ordered in your chart an NG tube, which is a nasogastric tube. It's going to go in your nose and down into your stomach, and it's going to help relieve some of that pressure. It's going to pump that contents out so you don't feel that bloated pressure anymore, right? You're going to get your head of the bed up at least to 45, almost to 90. Perfect. I'm going to start by looking in your nose. Have you had any facial trauma to your nose, preventing you from using a nostril? No? Alright. I'm going to look. I'm going to make sure you can breathe through both of them. I don't see any scar tissue. I'm going to use the left nostril closest to me. Alright? Perfect. So I'm going to get this tube. Actually, I'm going to get some tape. I'm going to measure 3 pieces of tape. I'm going to split one down the center. My dog ear one. All right. Now, I'm going to measure my tube to make sure I know what length. I'm going to go from your nose to your ear, and then to your xiphoid process, which is right here on your chest. And I got 50. So I'm going to mark that with a piece of tape. Awesome. All right, so we're going to get started with inserting it. I'm going to give you this cup of water. During the process, I'm going to instruct you to take some sips. Your chin is going to be on your chest. You're going to take some sips of water, and it's going to help the tube go down your throat. If you feel like something needs to come up, you're going to spit up into this tray. Now, I'm going to help make sure you don't get anything on your gown. So I'm going to put this on. Perfect. All right, now I made sure the suction is off, and I'm going to connect this so that nothing comes flying out onto you. All right. Perfect. All right, so here we go. I'm going to go in your left nostril, and I feel that you're gagging. Drop your chin to your chest and swallow. Ready? Swallow. You swallow. 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 Almost there. Swallow. Swallow. Last one. Swallow. Very good. All right. Now I'm going to check and make sure that I'm not in your mouth. Nope. I can see the tube going down the back of your throat. So I'm going to tape it on. My tape isn't very sticky today, so it might come out, but that's okay. We're just going to keep going. Perfect. Okay, I'm going to get rid of this. And now what I'm going to do is I'm going to check to make sure that I am in your stomach. Okay, so I can see there's contents coming out here. So I'm going to dump a little bit into my tray before reattaching. I'm going to test with my pH strip. All right, it looks like it's 3, almost 4, so it's acidic. It means it's in your stomach. All right. So now I'm going to firmly secure this to your gown. Put my piece of tape. All right, I'm going to take a safety pin.
That's what charting. You're not charting for the doctor, you're not charting for yourself, you're charting for the body.
All right, safety pin. All right, so now we're connected. I'm going to go turn the suction on to intermittent. Okay, and at some point we're going to get an x-ray to make sure that it is truly in your stomach. That's the golden standard. All right, so that's all I have today. How are you feeling? Good? Perfect. So I'm going to lower your bed all the way back down. I'm going to give you your call light, and I'll be back to check on you. And then I'm going to document, make sure it's in your chart so that everyone knows that there's 50 centimeters in there, that it's in your left nostril, that we're going to get an x-ray, the type of NG tube we use, all right? Perfect. Here's your call light. And you can press it if you have any questions. Is there anything else I can do for you? All right, you have a good day, Mr. Johnson.